your pain, fever, and possibly even for menstrual cramping. But you've likely also heard that ibuprofen is an anti-inflammatory. So today we're going to talk about how this medication works and discuss how it might not control inflammation in the way that you think. Plus, we'll discuss if this medication can cause any harm or potential side effects. Maybe you've heard it could affect the liver, the stomach, and other organs throughout the body. So we're going to take a look at those organs by utilizing the bodies behind me and again talk about how this medication works and if it really controls inflammation. So, let's jump into this anatomical and physiological awesomeness. So at some point we're going to need to be able to take an ibuprofen tablet and get it into the various digestive system structures so that eventually the medication can get absorbed into the body and take its effect. But first, what is ibuprofen? Ibuprofen, commonly known as some other brand names like Advil or Motrin, is classified as a non-steroidal anti-inflammatory drug, or an NSAID. Now, there are some steroidal anti-inflammatories. Maybe you've heard of things like prednisone or dexamethasone, but those steroidal anti-inflammatories work a bit differently and are often more potent. And so we'll save those for a different video and focus on these non-steroidal anti-inflammatories like ibuprofen. Now, ibuprofen has some pretty common uses. It's commonly used as an analgesic, which is a pain reliever, an antipyretic, which is a fever reducer, and obviously as an anti-inflammatory. But again, as I teased in the intro, we're going to find that it may not be reducing inflammation like you think it is. But first, let's get it absorbed into the body and figure out what it's supposed to do. And then we can come back to some more details about inflammation, as well as its potential side effects. Once you swallow ibuprofen, it will make it to the stomach and will start mixing with the gastric juices. Those gastric juices essentially include things like stomach acid, digestive enzymes, and even some mucus. Now, this is where the pill, or the tablet, is going to start to dissolve, and its active ingredients are going to be released. A small amount of it can get absorbed through the mucosal lining of the stomach, that you can also see here, and into the bloodstream. But the majority of it is still going to pass into the small intestine. And the small intestine is where the majority of the medication will be absorbed. The small intestine has tons and tons of blood vessels to absorb nutrients, or in this case a medication. And this whole timeline of where absorption can start to take place is about 30 to 60 minutes. But once the medication is in the bloodstream, that means it can essentially circulate throughout the entire body. And this is where we get into how ibuprofen actually works. Ibuprofen works by inhibiting certain enzymes called sialooxygenase 1 and cyclooxygenase 2, often abbreviated as COX-1 and COX-2. And what is important about these enzymes is that they synthesize substances called prostaglandins. Prostaglandins are extremely important to this discussion because prostaglandins are involved in multiple physiological processes throughout the body, which includes promoting inflammation. Prostaglandins are also involved in pain and essentially stimulate certain pain receptors. They are also involved with interacting with this structure in the central core of the brain, called the hypothalamus. The hypothalamus performs multiple functions, but one of its roles is regulating body temperature, including the fever response. We also see prostaglandins influencing uterine contractions, say, like during menstrual cramping, and so it can cause that smooth muscle in the uterus to contract. So you can see if we have a medication that inhibits or blocks the effects of these prostaglandins, you could help with period cramps, reduce fevers, inhibit pain, and potentially reduce inflammation. Now, I obviously emphasized potentially reduces inflammation because I've been teasing that ibuprofen may not reduce inflammation like you think it does. So let's address this. Now, as we've already learned, ibuprofen can help with pain, fevers, menstrual cramping, and potentially inflammation. However, the power of each of these effects are not equal, meaning a single dose of ibuprofen of like 400 to 600 milligrams for a headache, some muscle soreness, or even a fever kicks in pretty quickly within 30 to 60 minutes. And 1 to 2 doses is often enough to kick some people out of their pain. Then they get a good night's sleep. The underlying cause of the pain resolves, and they don't need any more of it. But for true anti-inflammatory benefits, this often requires higher prescription doses of like 600 to 800 milligrams, and requires much more consistent use of like 2 to 3 times a day for up to 5 to 7 days in order to sustain prostaglandin suppression enough to have a significant reduction in inflammation. So for those of you experiencing pain due to the pain receptors being activated by prostaglandins, or even prostaglandins stimulating a short-lived fever, a couple of doses is all you might need. But the inflammatory response is so much more robust, with multiple signaling molecules and white blood cells involved, that it requires much more to really suppress it, or even a flat-out stronger anti-inflammatory like a steroidal anti-inflammatory, such as prednisone. So, a lot of you who just occasionally use ibuprofen once or twice to help you with your pain, it can work very well in many of those circumstances, but you are not really getting an anti-inflammatory benefit from using ibuprofen in that way, and you don't really need it if you're just wanting to manage some acute, mild to moderate pain. People who do utilize the anti-inflammatory power of ibuprofen are going to be those people who are utilizing it for more chronic conditions, maybe like arthritis, or maybe they choose to consistently use it for a week for a major ankle sprain or some other injury. So to be clear, it's not like ibuprofen doesn't provide an anti-inflammatory benefit, because it does. It just takes a bit more than people think in order to get there, like higher doses and more consistent use for multiple days at a time. Let me briefly introduce a powerful tool that can provide valuable insights into your health: the Hume Health Body Pod. The Body Pod is a clinical-grade body analyzer that offers far more information than a standard bathroom scale. Instead of only measuring weight, it uses bioelectrical impedance analysis to generate over 45 health metrics, including skeletal muscle mass, body fat percentage, hydration levels, and metabolic age. One of its standout features is the ability to break data down by body regions. This allows you to see how fat and muscle are distributed between your limbs and trunk, and even compare the right and left sides of your body. This can be especially helpful for identifying muscular imbalances and targeting them during workouts. The BodyPod reports up to 98% accuracy. When I first began using it, I compared its readings with lab-based body composition testing done around the same time, and the results were nearly identical. Over the past several months, I've used it to log consistent weigh-ins, sync sleep and workout data, and set milestone goals that I can track in the companion app. As an added benefit, the BodyPod is eligible for HSA and FSA reimbursement. If you'd like to learn more, check the link in the description and use the coupon code, The Anatomy Lab, to receive 20% off. This discount can also be combined with current online promotions of up to 50% off. It's a great way to start optimizing your health routine. Now, let's return to our discussion about ibuprofen and its potential side effects. When discussing side effects, it's helpful to consider several organ systems: the stomach, kidneys, cardiovascular system, and liver. Many of these effects relate to prostaglandins, compounds in the body involved in pain, fever, inflammation, and menstrual cramping. However, prostaglandins also perform protective functions in various organs. In the stomach, prostaglandins stimulate the secretion of mucus that protects the stomach lining from its own acid. The stomach lining, mucosa, produces both acid and mucus. This mucus layer acts as a protective barrier. When medications like ibuprofen inhibit prostaglandins, mucus production decreases. This can thin the protective barrier, making the stomach lining more vulnerable to acid damage. Importantly, stomach irritation is not caused by the tablet itself, but by reduced mucus protection. Short-term use in healthy individuals usually does not cause significant stomach issues. However, long-term use or use in people with gastritis, peptic ulcer disease, or other stomach conditions may increase risk and should be approached cautiously. The kidneys constantly filter blood. Within the outer region of the kidney, the renal cortex, are microscopic filtration units called nephrons. Prostaglandins help dilate small blood vessels supplying these structures, ensuring adequate blood flow. When prostaglandins are suppressed by ibuprofen, these vessels may constrict, reducing blood flow to the kidneys and potentially impairing function. Short-term use in individuals with healthy kidneys is generally safe, but prolonged use or use in those with kidney disease may increase the risk of kidney damage. Healthcare providers often review kidney function before recommending ibuprofen, especially for ongoing use. The cardiovascular effects of ibuprofen are more nuanced. Prostaglandins help regulate blood clotting and blood vessel tone. Ibuprofen can inhibit thromboxane, a prostaglandin that promotes clotting, producing a mild blood-thinning effect and increasing bleeding risk. This is why patients are often advised to stop ibuprofen before surgery. At the same time, ibuprofen may inhibit prostacyclin, which helps protect blood vessels and prevent clot formation. Over time, this imbalance may raise blood pressure, cause fluid retention, and slightly increase the risk of heart attack or stroke, particularly with long-term or high-dose use. The increased bleeding tendency is more relevant with short-term use, while elevated blood pressure and clotting risks are more associated with chronic use, especially in individuals with heart disease, hypertension, diabetes, or smoking history. If you have cardiovascular concerns, consult your healthcare provider about alternatives such as acetaminophen or other pain management options. The liver, the body's second largest organ, plays a major role in processing medications. As ibuprofen circulates through the body, it repeatedly passes through the liver, where enzymes convert it into inactive metabolites. Unlike certain substances such as alcohol and high doses of acetaminophen, ibuprofen's metabolites are not considered harmful to the liver in typical use. These inactive compounds are eventually eliminated through the kidneys and excreted in urine. While active ibuprofen can affect kidney blood flow, the inactive metabolite itself does not directly harm the kidneys as it is excreted. This overview does not include every possible side effect, but covers the most important ones. Other NSAIDs, such as Aleve, naproxen, work in a similar way, though there may be minor differences in enzyme inhibition and side effect profiles. Because ibuprofen is one of the most commonly used NSAIDs, we focused on it today. Hopefully this explanation helps you better understand how this medication works. Thank you for watching and supporting the channel, and we'll see you in the next video.